cause of glaucoma. There are no known cause of primary open-angle glaucoma, but there is known cause for some secondary glaucoma that, like we said, that some studies have shown that some consequences of some surgeries, diabetes, and some other health conditions can lead to glaucoma. But really, we can say who are at risk to glaucoma. The people at risk to glaucoma is the aged. That means if you live so long, from 40 years to 60 years and above, you should be expecting that your eye could have glaucoma. Then we have people with family history of glaucoma. That means if your father, your mother, or a relative of yours have glaucoma, you have more chances of developing glaucoma than those who do not have those family history. If you have high blood pressure, if you have diabetes, you are also at more risk of having glaucoma than those who do not. Then the prolonged use of corticosteroids, that's an eye drop that takes care of inflammations, that is called steroid. If you use it prolonged without doctor's guidance or doctor's prescription, you may have a high risk of also developing glaucoma. So this falls under people who have the high risk of having glaucoma. If you also expose yourself to trauma, something hit your eyes, you are also at risk of developing glaucoma. So these are the risk factors of glaucoma. So you can see that when we say that primary open-angle glaucoma does not really have symptoms, as it were, that means that your eye can still be normal, you can be seeing clearly, yet you have glaucoma destroying your optic nerve head. So you can see that the only remedy or the only way to discover that you have glaucoma is by having a comprehensive eye examination by your eye specialist at least once every year. Because when your eye specialist checks your eye, he will be able to know if the optic nerve head or if the optic disc is already having signs that are showing that glaucoma is already destroying this optic nerve, and will be able to counsel you and advise you and start up treatment procedures that will ensure that your vision will not be lost. So what is the significance of this World Glaucoma Week? The significance is to create awareness and to make people to know, at least if we do it every year, people can use that opportunity to have their eye checked at least once a year, because it's an annual event. So if you even have people check their eyes at every glaucoma week, that will mean that they have had their annual eye checkup. And if they have glaucoma, it will be detected at that point, and definitely we could prevent further visual loss, because every vision loss to glaucoma cannot be reversed. That is one reason why we say have your eye checked. That means that once you have your eye, the optic nerve head destroyed with glaucoma, you cannot reverse any vision that has been lost to it. So you can see that World Glaucoma Week is a very serious, impactful program that educates the people and create awareness about glaucoma and have people to have their eye checked regularly. We in the Nigerian Optometric Association, we are an integral part in this eye care, in this sensitization program, to ensure that people have their eye checked. And I believe many clinics, many of our members across the 36 states of the Federation have opened their clinic wide open for people to have their eye checked free of charge within this glaucoma week. So avail yourself this opportunity and this rare opportunity to have your eye checked for glaucoma, so that we can together stop this silent thief of sight and to be able to see the world that is bright, because you can only see the world better with your eyes. Very good. Thank you very much for having me. Once again, I'm Dr. Nwosu, the Vice President of the Nigerian Optometric Association. Thank you for having me.